Our microbiology. Hello, welcome to our microbiology disease presentation of tuberculosis. My name is Holly Pierce. I live in Mesa, Arizona, and I'm studying health science.
Hi, I'm Taylor Peterson. I'm from Ogden, Utah. I'm studying health science and hoping to continue studying radiology.
Hello, I'm Stephanie Crockett, and I'm from Seattle, Washington, and I'm studying exercise physiology.
The correct name of tuberculosis is Mycobacterium tuberculosis. Tubercle bacillus can be used as a shorter name for Mycobacterium tuberculosis. Tuberculosis is a bacterial disease and is often called TB today. The earliest known tuberculosis recorded was found in a Greek literature back in 460 BC as phthisis. Tuberculosis was most well known in the past as consumption. It was also known as the White Plague, which hit Europe back in the 17th century and lasted for over 200 years and was the main cause of death in 1650. The earliest detection of TB was just discovered in human remains in 2008 in an eastern Mediterranean settlement over 9,000 years ago. Tuberculosis is neither gram-positive or a gram-negative stain because it doesn't have the characteristics of either. It does contain peptidoglycan in the cell walls, and if it does stain when dyed, it will stain very lightly or not at all. When this happens, it is called ghosts. In this picture, you can see a faint stain to the Mycobacterium tuberculosis. The morphology of tuberculosis is an individual rod-shaped bacteria known as bacillus. A few interesting characteristics of tuberculosis are that it is non-motile, which means it does not move. It is generally found in the upper lobes of the lungs, as you can see right here. It will retain dyes when it is heated, and this puts Mycobacterium in a category of acid-fast bacteria. This is because it can't retain certain dyes. The cell wall is unique because it is mostly made up of lipids, even though it contains peptidoglycan. It has many lipids, and this is the reason it is resistant to antibiotics and acidic and alkaline compounds, and why it cannot stain very well.
So humans are the only reservoir for tuberculosis. When TB enters the lungs into the alveoli, which are small sacs at the end of the lung bronchioles where gas exchange takes place, the alveolar macrophages are unable to eradicate them. There are two forms of TB, latent and active. Latent TB remains dormant in the host with no signs or symptoms. TB is not contagious when it is inactive. Active TB is when there is an infection and signs and symptoms are present.
The symptoms that the patient may feel of tuberculosis are a bad cough lasting longer than 3 weeks, pain in the chest, and coughing up blood or mucus from deep in the lungs. A patient may have other symptoms, and those can be weakness or fatigue, weight loss, chills, fever, loss of appetite, and sweating at night. Some of the signs that another individual may notice are persistent cough, coughing up blood, and weight loss.
The most common form of diagnosis for TB is a Mantoux tuberculin skin test. This is when tuberculin, a sterile protein extract from cultures of tubercle bacillus, is injected underneath the skin in the lower arm, usually on the inside of the forearm, as shown in the picture below. A positive test, meaning that either latent TB or TB infection is present, is shown by the area injected as raised, hard, or swollen with redness. A negative test, meaning that there is no indication of either form of tuberculosis, is shown by no change or reaction in the injected area. In the picture to the right, it shows what factors affect a positive test. For a healthy person with no known risk factor for TB, the reaction diameter will generally be greater than 15 millimeters. The treatment of latent TB is important in preventing the inactive bacteria from becoming active. There are 4 main medications taken, including INH, RIF, and RPT. These 3 are taken together for a period of time ranging from 6 to 9 months. A general medication procedure is shown in Table 2. Active TB is treated with 4 different medications, including INH, RIF, EMB, and PZA. These are also taken during a period of 6 to 9 months, following a regimen similar to that in Table 3. It is important to follow the medication plan, or the TB bacteria may become resistant to it and may become fatal. So the video that I am about to show you is of a new possible form of tuberculosis that is resistant to the 4 frontline medications used as treatment. They are currently working on a new treatment therapy.
Isolation at the National Institutes of Health. So as you pointed out, this has been ongoing for a couple of months now. She flew to Chicago, but then traveled around as well. We know to Missouri and Tennessee. It sounds like at some point they went to see the doctor, got this diagnosis, and was taken by special ground and air transport to the NIH at the level of concern. You mentioned it, Carol. This is a drug-resistant form of tuberculosis, something known as an extensively drug-resistant. There's moderately drug-resistant and extensively drug-resistant. What that basically means is that the 4 first-line drugs that are typically used for tuberculosis will not work in her case. Not to work in her case, they're going to need to find other drugs that will possibly be a benefit to her. That's what's ongoing right now, Carol.
So they're trying to track down everyone she came into contact with, which seems impossible.
It's a real, we've seen this before with other types of infectious diseases, even with Ebola most recently, Carol. It's challenging. First of all, the flight, right? 15-hour flight to Chicago. We know that airplanes, as a general rule, aren't great places for infectious diseases to spread because they're well ventilated. TB does spread in crowded places that are not well ventilated. But that flight, that air flight, the first place they start to check within a few rows of where she was sitting. And then they're going to look in all the other places that she spent time, and how much time did she spend with certain people. It takes prolonged contact. While it spreads through the air, it's not just a quick sort of transmission. You need a lot of contact with the person over many, many hours, many days even. So who were those people? Do they need to be tested? That's what they're doing. That's part of the investigation.
What could be?
Well, I'd like to recommend the superdet.
The transmission of tuberculosis is carried in airborne droplets. These droplets are exhaled or released by the person coughing, sneezing, singing, or yelling. These droplets can also stay alive in the air for several hours. For example, if a person sneezes and later someone else walks through those same airborne droplets and they are inhaled, that person may have contracted TB. After someone inhales these droplets, TB settles deep into the alveoli of the lung. This shows the movement of airborne droplets. As you can see, they travel quite a bit. You can often feel the droplets of water when someone nearby sneezes. However, there is so much more to this cough or sneeze than the eye sees. Everyone who has came in contact with these droplets may have contracted TB. A chest X-ray, like mentioned before, is one way that TB can be diagnosed. As you see in this X-ray, the disease created ring-like patterns within the lungs. It is also known for its cracked glass-like appearance. Although this can tell us if in fact the patient does have TB, this cannot tell us whether the TB is active or dormant.
In order to prevent the spread of tuberculosis, one should limit their exposure to those that are diagnosed with the infection. Those who have the infection should seek medical treatment and be mindful of others around them. Washing hands often is always a good precaution. Those who work in healthcare should regularly be tested for TB because they are more likely to be exposed to the infection. There is a vaccine for TB that's abbreviated BCG. This is not typically given in the United States, but to children and infants in other countries where TB infection is more common. This vaccine is not always effective and also leaves a large scar on the arm where injected. In this picture below, the dark green areas on the map show where this vaccine is most commonly given to infants.
Interesting facts about tuberculosis include that TB is the #1 cause of death worldwide. TB affects about 1/3 of the world population, but is declining in the United States. If you have or are having symptoms of TB or want a screening, the Student Health Insurance provides one free test for TB at the Student Health Center each calendar year. TB has made quite an appearance in the news recently. There has been 2 cases back in June where people have tested positive in the United States. One case was in El Paso, Texas, and 35 cases were confirmed positive. The other case was in Maryland, like mentioned in the video before. A woman traveled back from India and came back with a drug-resistant form of the disease. Everyone nearby on the plane now must be tested. These are our references, and we just want to thank you for watching our presentation. Have a great day.
Thank you for watching.
Thank you for watching. Have a wonderful day.